Chris, what is the situation regarding COVID-19 at the moment in Malta?
Yes, at the moment we can see that the numbers are increasing. There is transmission for sure. The R factor has gone over 1, so one person is infecting more than one other. So the situation is that the number of cases infecting are going up.
Okay.
So what are we doing? We are at the moment trying to swab as much as we can and contact trace. Now the numbers are increasing, the contact tracing is trying to cope with all these numbers of new cases. The hospital is struggling to take the people who need hospitalization, and unfortunately we are also seeing a number of deaths. So this is not a happy situation at the moment. However, we have now to look at the numbers as they are and see what we can do so that we put the numbers down. And
So what can we do?
the first thing is ourselves, because everyone is saying we're getting the vaccine, it will be all right, etc. But it's not the vaccine which is going to solve the problem. We have to solve the problem.
There is evidence that vitamin C, vitamin D, quercetin, N-acetylcysteine, apart from sleeping, among other than zinc, these are the 6 things which are at the moment being touted, so to speak, as having, not necessarily being a cure, and this is important, but the idea is that based on past research with the influenza viruses and previous viruses, there's a body of evidence to show that these can minimize the impact of COVID-19. So in other words, minimize the symptoms. What do you think about these remedies?
This is correct, but it is partially correct. So used on their own, this is not going to solve the problem. These are all minerals and
lifestyle behavior.
Lifestyle behavior, but it's all things we have in our food. We can take supplements of these, and these are all going to boost our defense system. Okay? So whether it's influenza, whether it's COVID, this is always better to find some resistance and protection in our body.
So does it make sense to take these prophylactically, in other words, as a preventer,
yes,
or to minimize?
The studies which we have read are showing, for example, certain vitamins like vitamin D, it's very high doses to make a difference.
Right.
So we have to be very careful, because sometimes too much dosage of a particular vitamin can do more harm than advantage.
So the take-home message is make sure you don't take these things alone, take them under supervision, especially if you have some medical conditions, and also a nutritionist as well. Chris, what about the situation whereby at the moment, do we have enough beds at Malta Day to cater for the situation?
The number, as things are, is that the number of COVID positive patients are high. So, and they're getting higher every day, because the R factor is obvious, is more than 1. So one person infects more than one other. So, of course, once the numbers are up, we're going to see higher hospitalization rates, higher mortality, especially at different age groups. And one important factor we're seeing today, because the numbers have increased, the age group being affected has also lowered as well. So everyone has to be careful. Now, the hospital capacity, it all depends on the numbers of cases we're going to have.
So it depends on us, on how responsible
it all depends
we are,
on us.
On how responsible. Remember that the virus is stupid. It's just a piece of protein, as Chris says. We have our brain. Let us use it to our advantage. Chris, what do you have to say about people, about the schools? Right now there's a lot of stress and pressure. Is it correct to say that if there aren't the social distancing measures, then one would rather go to online learning?
Of course. I think this virus, we've learned a lot in these last 7 months.
That's important,
now. We've got lots of knowledge about the virus, which the virus has no knowledge, as you were saying, no intelligence whatsoever. We started getting this knowledge from China, from Wuhan, when it started first. We believed, we started mitigating initially, and you remember I was everywhere saying we have to flatten the curve, and everyone was really helping in flattening the curve. Today, unfortunately, people know what we have to do, but they are not doing it. So, if we are socially distanced as we are now, if we should be wearing a mask, if we should be washing our hands, people were doing it initially, and the number of cases was kept low. Today, it seems people, that's part of the problem, because then we have other problems, because before the restaurants were closed, the airport was closed,
course, and
etc.
that's a big issue.
So altogether, now that we have the airport open, the restaurant open, and I have words of praise for the people at the restaurants who are really taking full mitigation measures. Okay? But then if we ourselves don't take those measures, then we're going to spread.
You're quite right, Chris. In fact, anybody from the headmaster to the director, to the entrepreneur, to the restaurateur, to the person who manages cruise ships.
It's the weakest link which counts.
And that is it. So even psychologically. So let us all try and work to address our anxiety. Let us not exaggerate, but at the same time not minimize the risk. As Chris is saying, vigilance, it starts with us and it ends with us. The next few months, I suppose, are going to be crucial, Chris.
Very much.
Is it important to take our influenza vaccine, and why?
Yes. It's important to start now. Now, besides having the COVID, there is the influenza season coming. It takes about 2 weeks for us to build our immunity. So, we don't want people to be suffering from two conditions at the same time. The symptomatology, the sneezing, the fever, the shortness of breath are exactly the same. You can't clinically
distinguish one from the other.
So let's help the doctors, let's help ourselves, let's get protection against one of these viruses, so that then we can even tackle the second one better.
Right, so I think the take-home message is there. Let us address our physical health to address our psychological health. It's not rocket science. Let us all be vigilant. Let us avoid this concept of invincibility, and because that's important, as Chris is saying, we are as strong as the weakest link. And if anybody is or has been affected by this, or know that somebody is suffering, because there are a lot of people suffering out there, please reach out. You know where to get help. Chris Barbara, thank you very much. Once again, we'll be updating you in due course. And remember, it is totally, completely in our hands to go one way or the other. That is, after all, the definition of a crisis. Let us all be members of a crisis team in order to find the next level to take care of Malta and indeed the world. Thank you very much, Chris.